So our next speaker is Dr. Michael Buckland, Clinical Associate Professor at Sydney Medical School, University of Sydney, Australia, Director of the Australian Sports Brain Bank, and Australian Veterans Brain Bank. And he's going to be talking about chronic traumatic encephalopathy in Australia, the first 6 years of the Australian Sports Brain Bank. Dr. Buckland is a senior staff specialist and head of the Department of Neuropathology at Royal Prince Alfred Hospital. He's the director of the Australian Sports Brain Bank and Australian Veterans Brain Bank, and has published the first reports of CTE in retired players of rugby league and Australian rules football.
Thanks very much, and I was very pleased to be asked. So thank you very much for hosting me. So today I'm going to be talking about my experience with CTE in Australia, and just as a bit of background. I'm very fortunate to be a full-time neuropathologist. In Australia, that specialty doesn't exist. Most of my colleagues have to do all the rest of anatomical pathology as well as neuropathology. So they'll spend 2 days doing gut biopsies and then having to do a day of brains. But I'm very lucky in that full-time I do neuropathology. There's only 2 standalone units within the country, and that's probably one of the reasons why Australia has sort of lagged behind in the identification of this disease in the country. So my general day-to-day work includes doing the work for the New South Wales State Coroner, looking at brains that come to the coroners. And that's quite busy, as New South Wales is the most populous state in the country. We do a fair amount of CJD surveillance work, a lot of hospital autopsies, and generally the routine work's about 100, 140 brains a year that pass across my desk. And for a while, I had been reading the literature that had come out of the Boston Brain Bank, and the beautiful illustrations of the pathology of CTE that had been done by Anne McKee. And I kept wondering, how I never see this? How come I never see this? And I think I was a little bit slow. It took me a while to realise that, in fact, I probably actually wasn't looking at the right population, and that maybe if I did look at the right population with the right techniques, maybe I would see it. And I think for me, it was really this fellow's death that really sort of catapulted me into it. This was quite a famous wallaby, and he was, so that's an ex-Australian rugby union player. And he was Sydney University based, had come back to the university, was very involved in the Sydney University team. And then everyone was very shocked when he hung himself. I think it was in 2017. And for me, I thought, well, if anyone's going to have it, it's going to be this guy. And I was obviously doing a lot of work for the coroners. And so I went to the coroner and said, look, we have to look at this guy's brain. You know, if anyone's going to have it, there's a disease around, we need to do it. And the coroner said no. And I went back and asked again, and they said no, and got a little bit heated. But unfortunately, in the end, I was not allowed to look at this fellow's brain. And the reason why is because of this clause in the Coroners Act in New South Wales. I don't know what it's like in Canada, but certainly in Australia, Australia is quite similar to Canada in that the health systems are very much state-based. So they have state-based funding and state-based rules. So every state will have a different Coroners Act, but they almost all have this clause in them now. And this clause, I think, was put in by well-meaning politicians about 20 years ago about respecting the dignity of the deceased person. And that sounds very reasonable, sounds like a good clause to have. But unfortunately, there's this bit in it saying that the person conducting the examination is to endeavour to use the least invasive procedures that are appropriate in the circumstances in order to establish cause and manner of death. Now, unfortunately, there's that word appropriate. So certainly the coroners that we work with are very hard line. And I think they've forgotten that that word appropriate is in there, because they say, the story is, this fellow, and by the way, I'm allowed to talk about all the people I'm going to talk about today, but this fellow had hung himself and he left a suicide note. There was no evidence of foul play. So that means he had an external examination of his body. He had a little bit of blood taken for toxicology, and then the coroner writes a death certificate. And it took me a while to realise, in fact, the last 20 years, pretty much everyone in New South Wales and pretty much everyone in Australia that commits suicide does not have any examination of their body, and most certainly does not have their brain examined. So I decided we needed to set up a system where families could be approached to ask if they did want their loved ones' brains examined and to give their consent through a non-coronial pathway. And I was lucky or unlucky enough to have someone introduce me to Chris Nowinski from the Concussion Legacy Foundation in Boston. And he came out and helped us launch the Australian Sports Brain Bank. And that was in March 2018. The week after we launched the Brain Bank, I got this email from Dan Vickerman's mother, which really touched me a lot, because it made me realise that certainly when there's an unexpected death, such as a suicide, the families are in a lot of grief, and they are looking for guidance from the authorities about what to do, et cetera, et cetera. So once the dust had settled with this family, they went and did some reading and thought, why didn't anyone look at our son's brain? So when I got that email, I realised that I think this was the right thing to do. And unfortunately, unfortunately, as soon as we started looking, we actually started to find this disease, a disease that to that date had not been described in Australia. And one of the most remarkable things about CTI, I think, is that it's the only disease I know of that we actually now understand less about than we did in 1994, at least according to the authorities. So in 1994, the peak medical body in Australia, the National Health and Medical Research Council, published an inquiry into boxing injuries. And this was a statement from the Royal College of Physicians of Australia. There is overwhelming evidence that the cumulative effects of repeated cerebral injuries observed in boxers can eventually lead to a syndrome of progressive intellectual impairment and motor system failure. This condition has been observed and described clinically so frequently that it is part of standard texts of neurology, neurosurgery and medicine. So it's a pretty strong statement. So we thought we knew what was going on in 1994. But currently, this is the Australian Institute of Sport position statement on concussion and injuries in sport. And they say the link between sport-related concussion and CTE remains tenuous. So now we don't know. And I found that quite striking. And I think one of the reasons for that is this concussion in sport group. And I found this wonderful diagram from a Canadian news agency about this group. The group, this 36-member group, of that, 32 members had very close ties to professional sporting organisations. And this is the group that meets every 4 years and pronounces what we know and what we don't know about concussion and head injuries in sport. And you'll see that there's only down the bottom, I think there's only four individuals that aren't in that spider web there. In fact, Dr. Tatter, you're down at the bottom, I have seen. But most interestingly, it's in the middle of this spider's web is Professor Paul McCrory. And Professor Paul McCrory is a neurologist from Melbourne. And for 20 years, he chaired the Concussion in Sport group. He was the chief editor for the British Journal of Sports Medicine. So very much in an incredibly influential position in the whole concussion debate. And unfortunately now he's had multiple papers retracted and notices of concern placed on dozens of others, and has had to stand down from his role. It's really cast a shadow over sort of the whole concussion in sport group. So I think he was internationally influential, but very influential in Australia. And certainly when I started, I was told by colleagues that it was all bad science and media hype. To this day, I've had colleagues that have not spoken to me since we launched the Brain Bank. Anyhow, so that's the background. And just very briefly, I want to give you a definition of CTE. So today in 2024, the CTE is actually defined by how it looks like under the microscope, rather than how the person looks like to you in the clinic. And that is the defining lesion. It's the accumulation of this abnormal tau protein in neurons at the depths of cortical sulci around a small blood vessel. And I'm sure many of you would know that tau is a protein that accumulates in a lot of degenerative brain diseases, such as Alzheimer's disease, along with beta amyloid and a lot of the frontotemporal dementias, but very much accumulates in CTE. So to date, the only known cause of CTE is exposure to repetitive head injury, which we think is really a proxy because it's an exposure to a repeated mild traumatic brain injury. And notice I'm not saying concussion because the risk of CTE correlates very poorly with reported number of concussions. What it does correlate with is numbers of years of contact sports played. So it seems to be that it's multiple blows to the head. Some of them may well give you a concussion, but the vast majority don't give you any signs or symptoms at all, but seem to be causing very subtle, mild injury to the brain. And most of us, will bump our heads here and there. So the brain can cope with some of these bumps. But when you get hundreds, if not thousands, or even many thousands of them, that's what sets you up for later in life degenerative disease. So I'm sure I don't have to tell this audience, the cortex is very folded, and it's those valleys that are called the sulci. So it's right down in the depths of those valleys that you get this accumulation of the hyperphosphorylated tau. You can see that on the right-hand side there. So briefly, the clinical features aren't very well understood. At the moment, it's not able to be confidently diagnosed during life. Advanced stages often mimic Alzheimer's disease, and that people have problems with thinking and memory and planning. But less advanced cases, or cases in younger people, often have a flavour of mental health disorders to them, such as depression or mood swings, impulsivity, explosivity, loss of attention, concentration, short-term memory loss, and headache. They also seem to overlap with signs of symptoms of concussion, and particularly post-concussion symptoms. And it's quite regularly we would get calls from people that after a few minutes on the phone, you realise this person has had a concussion and are now suffering from post-concussion syndrome, and they don't have CTE. Because really the typical picture of CTE is that someone retires from sport and they're fine, and then at some stage afterwards, there's this gradual insidious onset of this sort of decline, either in their mood or behaviour or memory and thinking. And probably this is just to remind me that most of this work has been worked out in American football. So not only the pathology, but also this the clinical picture, and it's all being done through retrospective interviews of family members and friends of people that have died and been diagnosed with CTE. So also, I just wanted to give you a bit of introduction to sports in Australia, because they're quite different to Canadian and American sports. And based at least on this this table here, the people watching, the most popular sport is Australian rules football, followed by rugby league, which is sort of a bit of an offshoot of rugby union, followed by soccer, cricket, rugby union, and then basketball. But by far and away, Australian football is the most popular, and I have to confess I still don't understand it. But most people do and are very passionate about it. So I've got a couple of videos just to show you what they're like. So this is rugby league, and this year they managed to get into Las Vegas to launch their season. And the whole idea of that is they're chasing the betting dollars. Betting revenue is very important in sports these days. So I hope this is not too loud, but just to show you the sort of stuff they do, if I can start that.
It's football, but not as you know it. No helmets, no pads, no timeouts.
Oh.
Rugby league is unleashed for the very first time in the entertainment capital of the world, Las Vegas.
So you can see, that's Russell Crowe, by the way.
Be there to witness the 2024 season opening doubleheader. National Rugby League.
Even though they say they care about the welfare of their players, they're still very much promoting the biff in the sport, and they're still selling it on that. And I'm sure there was half a dozen traumatic brain injuries in that ad. And then this is Australian rules, and this is actually just a video of some bad hits. So it's a little bit traumatic to watch because they are quite bad hits. But you'll see it is very different sport, played on a giant round oval.
Playing well, or suddenly looking aggressive.
So you can see even, I mean, this is terrible, sorry, but like the physique of the players is different. They do a lot more running, but it's very much a 360-degree game. And a lot of the concussions are because the guys are looking at the ball and they're not looking at each other. But yes, so in fact, the number of concussions in Australian football is actually higher than rugby league, despite rugby league players being big groups. I think that's because they see the person coming and they're not allowed to be seen from behind. So I guess watching those videos, it wouldn't be surprising that within a year we were able to find 2 cases of rugby CTE in former NRL players. And we published those just as a letter to the editor. And that what I wasn't prepared for was I had no idea how much media interest there was. And I know people say it's all just media hype, but I really do think it's tapping into a concern out there which has not been answered. So the family, very soon after that paper, the family came out and talked about, it was the children talked about their dad. And their dad certainly, he was in his 50s and predominantly had the memory and thinking and planning problems. There didn't seem to be a lot of the behavioural or mood issues. And they're very supportive. And as I've said, everyone I've talked to, I'm only identifying people where the families are very happy for us to talk about them. And then the year later, we were able to find CTE in the first former Australian rules football player. And he had a diagnosis of Alzheimer's disease. And probably about half the cases we have diagnosed have come with Alzheimer's disease written on their death certificate. We're yet to have a case come to us with CTE written on the death certificate, which makes it very hard to do epidemiological studies. So one of the criticisms of the CTE literature is that, there's not population-based studies on it. But the problem is you can only diagnose it at autopsy. Doing a death certificate review doesn't help because no one has been diagnosing it, even though it's there. So it is a problem, and we hope that one day, and hopefully soon, there'll be good clinical diagnostic criteria to be able to power those epidemiological studies because you can make the diagnosis during life. This fellow was remarkably famous. Again, I didn't know because I don't follow the game, but he was a Graham Polly farmer, diagnosed with Alzheimer's disease at age 64. The family had said he was not right for at least 5 years prior. But he was the first of the great Indigenous players, and there's certainly a very strong connection between Indigenous Australians and Australian rules football. And really, he was the first of the greats and often referred to as the father of the modern game. And in fact, when I went to Perth and visited the family, and I drove along the Polypharma Freeway. So he was obviously a very big name. So I think soon afterwards, I realised that the way we're going to actually get action on this is to keep putting it under the noses of the coroners, because the coroners can investigate deaths, and the coroners, and I assume it's the same here, the coroners can also, part of their remit is to look at issues that have public health implications. And certainly, say, with Australian rules football, we know there's over 1.5 million registered players in Australia, and Australia's only got 25 million people, and most of those players would be under the age of 30. So that's a significant proportion of our youth that are being exposed to this. So that's, I was very much pushing it with the coroners, and I was lucky to already have some lines of communication through my work. And this was the next fellow we diagnosed, Danny Frawley, who again was very well known and very well loved because he was on the footy after he retired from footy, footy great, and then he was on the footy show every week and very much loved. And he had been public about his battles with depression, but then one day just drove his car into a tree at about 150 kilometres an hour, and so obviously was a coroner's case. And he had terrible CTE. And for the first time, the coroner started to consider CTE in their investigation into the death of this ex-footballer. And the findings were released in 2021. They were relatively measured because coroners are very cautious people, but they did make some good recommendations, and that was that the AFL should, or the Australian Football League, should encourage all players to donate their brains to the Australian Sports Brain Bank, which we thought was terrific. And then a few months later, the AFL responded back to the coroner's recommendations, and they basically said, yeah, no, we're not going to do that. And so while coroners can make recommendations, they're not legally binding. So it was disappointing, and certainly for me, the first experience of sort of that corporate response to the issue. They did say that they were going to look at encouraging people to donate to brain banks, but not just the Sports Brain Bank. But actually, at the moment, there are only 2 brain banks in Australia that are active. So it was either us or them. But they were going to sort it out before the end of 2021. But it's 2024 now. We still haven't got there yet. Then this was the Medical Journal of Australia. We managed to decide after 3 years, we'd just publish our aggregated results from the first 3 years of collecting brains. And I should say a lot of these brains, it was up to me to find the families somehow and to give them a call and ask and speak to them. And it was remarkable how many families were very happy to do so. And, some people think it's like a bit of a gross thing to do, a bit sort of very awful to be dealing with dead people and calling grieving families. But it's actually quite a remarkable insight into human nature, a very positive one, because most families just want to help others and they want their loved one's death to help other people. So it's quite uplifting. And certainly I think it's actually better insight into human nature than driving in Sydney traffic where everyone's just awful. But this is the aggregated response results here. So we sort of definitely aggregated it to make sure everyone was anonymous here. But the column you can see the column on the left is CTE present, and the column on the right is CTE not present. So 12 out of the first 21 brains had CTE. All of them were men, probably reflecting the popularities of the sport. Most were, the highest number was Australian rules, followed by rugby union, rugby league. 8 out of 11 professionals that donated had it. The majority were low stage rather than high stage, 10 of the 12. And half of them just had pure CTE and the other half had other related pathologies like Alzheimer's disease. And certainly 6 out of the 12 had died from suicide. It's a very controversial topic about, is there a relationship between suicide and CTE? And I don't think we know yet, but it's certainly a disturbing association. This is a rugby league player. He died at the age of 32. Was on some pathway to try and get into the professional league, but ended up having a little stroke after a tackle when he was 21, so had to give it away. And then sort of a few years later, started to just go off. And that you can see that's the tau staining, and it's in neurons and their processes, and it's around a small blood vessel there. And you have to take my word, it's down at the depth of the sulcus. At this stage, the definition back then was that the tau had to be in neurons and astrocytes to fulfill the diagnostic criteria. It was revised a few years ago just to be neurons. But I certainly noticed in these cases, it's very hard to find astrocytes. It was mostly just neuronal. This is another case. This, again, a rugby league player. He was only 20 when he died, and again, was about to make it into the first grade competition when he died. He died from an unrelated issue, and as far as we can tell, he was normal. He didn't have any signs or symptoms, but that's okay. That's fine. We know certainly with Alzheimer's disease, there's a long prodromal period, and you probably have the disease for 20 years or more before you start to actually display any deficiencies. So it's very likely that it's similar with CTE, that you can have a sort of a pre-symptomatic phase, and it may well be with lifestyle modifications, looking after your brain health, that you can extend that prodromal phase for a long period of time. We don't know, but it's not necessarily a death sentence just there and then. So interestingly, I actually had to speak with Anne McKee, because both those cases were just pure neuronal tau, and Anne had said, oh yes, we're actually seeing the same thing in our very young players. It seems to be in the very young people it starts, and the neurons and the astrocytes come in later on. And so we were able to, for the first time, collaborate with them to publish. It's our case. Panel B is one of our cases. And soon after, about the same time this paper came out, that the diagnostic criteria changed to reflect it only had to be neurons, not neurons and astrocytes. Now this is a slightly disturbing video as well. It's a little bit traumatic, so I just warn you. But this was that first case. This is the 32-year-old. I wonder if this one will play.
It was an hour of terror. A bodybuilder armed with a pump-action shotgun on a shooting spree through 3 Western Sydney suburbs. He first targeted the home of his pregnant former lover before his fatal face-off with police. Hannah Sinclair begins our coverage.
Underneath all that muscle, behind that smile, there was an angry man. Daniel King killed by police after a frantic string of shootings. The bodybuilder was armed with a pump-action 12-gauge shotgun, the same used by tactical officers, when he opened fire at a patrol car outside Penrith Police Station last night. At this point, as we freeze vision, King is hit by police bullets, collapses to the ground, officers continuing to shoot.
You can see the silhouette of the gun.
Stop it there. Yeah, this fellow had there was a coronial inquest, and you might notice he was just standing there, and the coroner actually decided this was actually suicide by cop. So the police admitted that he had multiple opportunities to take kill shots and declined to take them. But I think this for me was really the first insight into sort of the burden of the unknown burden of this disease. It's not just we lost one life or we had a family breakup, but you can imagine, I mean, those poor girls in the video, they must have needed counselling. All those police were traumatised. He had like buckshot in his shotgun, and a couple of police got hit by little bits of buckshot, but they weren't seriously injured. But there were, at least at the time of the coronial inquest, there were a couple of people in the station, the radio operators, that it was several years afterwards, had been unable to return to work. And the coronial inquest must have cost $1 million or $2 million just to run that. So there is a significant economic burden to this disease, which we still don't really understand. And I think Australia is quite like Canada in that we have a public health system. So taxpayers pay a lot of money to fund the health system. And certainly in Australia, the big sporting codes, so the sporting organisations, they have tax-free status because there's some clause about entities that promote, healthy lifestyle. So a tax-free status is essentially the taxpayer is paying for them, is supporting them, and then the government builds them stadiums, and then also at the other end, we're then paying to pick up the pieces. So I was really excited. Last night or the night before, I met a fellow called Jesse, who was a health economist, because I think that's how politicians are going to. That's how you're going to really get their attention, when you show them how much it's costing. And I really think it's going to be a very powerful argument in the future if we can get health economists involved to try and estimate the burden on the healthcare system of this disease. So at the same time, we were trying to get these brains, because I was doing this other routine stuff. I decided I'd start screening all the brains that came through the lab from anyone that was 18 years and over, just with 3 cortical blocks, staying them for tau, to see how common it was. And overall, we had to exclude cases like CJD, and then there was MS Brain Bank, which had separate ethics. But we were able to look at 180 cases, and it was over the identical time period of that MJA paper, the first 3 years of the brain bank. And we did find it in 4 cases. So we had our unselected clinical cohort is here. But over that same time, because we have sort of a general brain donor program, and we had 18 people that had diagnosed, that had donated through that. So that, again, the same sort of bias that you get in the sports brain bank, in that people, if there's something wrong with their brain, they're much more likely to donate if they think there's something wrong. And certainly the dementia donors knew there was something wrong with their brain, but we didn't find it in them. We did find low-stage CTE, you can see there, in 4 of that 162 unselected cohort. And this is them here. We had 3 males and 1 female. And you can see 2 of them, case 1 and case 3, had poorly controlled epilepsy with multiple tonic-clonic seizures. So we think that it's, while there was no written evidence of traumatic brain injury, I think if any one of you have seen a tonic-clonic seizure, you could imagine that there could well be repeated head impacts and repeated mild TBIs. Only 1 of the 4 had evidence of substance abuse, because often there's this thing saying we don't know the contribution of drugs and alcohol. And I know Gabor here has published very well on the pathology of opioid abuse, and it's certainly not CTE. 1 had a history of brain surgery with complications that required insertion of multiple external drains. So another sort of repeated trauma to the brain that's a bit different. And then one did actually have a long history of boxing. So all either had documented or very plausible histories of repeated traumatic brain injuries. So we just clicked over to 6 years last month. So this is very preliminary data and it's not very well analysed because I did it in a hurry and I'm not very good with statistics. But I just wanted to show you what we've got now. So after 6 years, we had 103 brains collected. So every year, and actually after every time we got something in the media, we'd get multiple hits on the website with people registering to donate their brain after death. So even though people complain about media hype, it's an incredibly effective recruitment tool. 90 of the brains have been finished, and this is the analysis. So yeah, that's Australia, and this is the red dot is where we are, and this is the different states and territories where we're able to collect the brains, and it sort of reflects the relative population in each. But I guess I also wanted to say that because everything is state-based and all the legislation and the coroners are all state-based, it's actually turned out to be an extraordinary amount of work to be able to collect across the country. But it can be done. And I certainly think that's really is the way of the future and a very effective way to do it. So of those 90 brains, again, we've got the present and not present. We had 44 out of the 90, so 49%. So essentially still sitting on 50% CTE diagnosis rate in this at-risk population. Our suicide rate, I thought it was going to be 50%, but it's actually 43% now that suicide we collected compared to that 17% where CTE is not present. And for the first time, we're able to identify CTE in a female sports person. And we published that last year, and this was a female ex-professional Australian rules footballer. So yes, as far as we know, the first female professional athlete diagnosed with CTE. She was 28 years old and actually had played in the very first ever season of the professional women's competition. So it's a little bit unnerving that even from the first season now we have a case. She was very well known for her wearing her pink helmet, and she died from suicide. That's her contact sports history there. And you'll see that she's an avid footballer from 5 years, total contact sports history of 18 years. Played mostly Australian rules football, some rugby league, but then in mid-teens onwards was AFL. Also had done some martial arts and also had been in the military for a while, including some special forces training. So different histories of probably, TBI or mild TBI, repeated head impacts from different areas, but predominantly Australian rules footballer. And that's her there in the pink helmet. And that's a great picture because she's playing with that's Heather Anderson in the pink helmet, and they're tackling Jacinda Barclay, who the previous year had committed suicide, and she was the first female to donate her brain, professional female to donate her brain, but she didn't end up having CTE. She had a lot of white matter gliosis, and we're sure there's something there as well. I think most people would agree that it's not just the tau that's the problem, and I think that's a challenge for now, is to find out those other pathologies. That's her, it's a couple of her lesions there showing that neuronal tau. And this was just to remind me that we are aware of the issues with the military as well. So last year we launched this Australian Veterans Brain Bank. To date, we've only got one brain donation, but we're very interested in building that in the future. And then here, just so now in Australian rules football, we've had 18 cases diagnosed, 13 professional, 5 amateur. Rugby league, 15 cases diagnosed, 11 professional, 4 amateur. Rugby union, 6, 2 professional, 4 amateur. And then a few others, boxing, lacrosse and motorbike racing. Look, I'm out of time, so I might actually just flick through all this. I had a lot. I knew I had way too much, but again, we're seeing again. This is just my very bad statistical analysis. I'm embarrassed to show it, but the pure CTE cases, which is the box, the yes box. So just CTE, you find that in the young people, and there seems to be some split around about 45 years. If they're 45 years or under, they almost always just have pure CTE. And over 45 years, you start to see increasing numbers of other pathologies such as Alzheimer's disease. But I might just finish up there because we're out of time. I could talk about this all day, but I am out of time, and I know Professor Tat is right there. So thank you very much. Thank you.
Thank you very much for sharing all of that, your findings with us. It would have been nice to get to hear the rest as well. And we have time for a couple of questions. Does anyone want to ask a question?
Thank you for that great talk. And, I have to thank you for finding it in a woman and publicizing it, because until now it's been very difficult to engage women to think about the long-term consequences of their brain, even though we see more of them in the post-concussion symptom clinics. But what do you think the future holds based on, I don't know if you heard Chris this morning was talking about the fact that in smoking literature, women were 20 years behind in terms of finding the lung cancer. Do you see this, or maybe you caught it, in time?
Yeah, I agree. It's just it's a matter of time. It's great they have that equal opportunity to be professionals, but they're going to carry the same risk, if not a higher risk. And we will see that play out over the next 10 or 20 years, I think. But, I sort of hope, because the games are newer, and I think women are smarter about their health. So maybe that's where we're going to see the driving of change is through the female professionals, and they might drag their reluctant male counterparts along with them. I don't know. But I think the burden of disease, based on the way they play, is going to be the same, if not worse.
That was absolutely superb talk. Last year we had Ed McKee as our keynote speaker. This year we have Michael Buckland as a keynote speaker. So we're really well informed now about CTE in the USA and in Australia. And you've done a remarkable job of collecting cases. My question that worries me is the issue of suicide. And your data, I think, is the most flagrant that I've seen in terms of the number of cases that you now have that have committed suicide. And yet, spokespeople for the concussion and sport group, which I'm aligned earlier, and then you've elaborated that they tried to cover that up. That's one of the efforts that they put on to pretend that this condition doesn't lead to suicide. I'm going to give a comment on that. Was there anything different about the distribution of how in the brain those who committed suicide compared with those who did not? Any clues about why we saw so many suicide cases?
Look, at this stage, no, and it looks the same, and we're seeing the same distribution of the lesions. And I don't know, I mean, just listening to all the talks today, we keep hearing, we know even concussion leads to people having problems with depression and anxiety and so forth. So, and concussion is, presumably a lot of these people had multiple concussions as well as other impacts. So it might just be another effect of this repeated traumatic brain injury rather than the CTE per se, which also arises from the traumatic brain injury. But there's definitely something there, and I don't know how to tease it out yet, but I do like being flagrant about it because I agree that it's tried to be challenged and pushed under the carpet, and there's definitely an issue there. Certainly the impulsivity seems to be something that symptom of CTE. They've had lots of families talk about that. The first case we saw, the guy had an argument with his girlfriend. He was lying on the couch in an apartment on a high rise, and he just said, F it, and ran and jumped off the balcony. And so it was like there was no premeditation. It was just like a snap decision. And that Danny Frawley, I hadn't realised until I spoke with the family afterwards, but he had three lovely daughters that he had promised 2 days earlier that he would never do that to them. He was not going to do it. And they felt so betrayed because there was no signs or symptoms. He just one day he was driving back from the farm and just drove his car into a tree, and they felt like he'd lied to them. But I think in retrospect, it was that impulsivity that he just, at that moment, he felt down and just thought, bugger it, I'm doing it. So that could be a mechanism, but I'm not sure.
I'm curious to know if you think that could be tied in any way to, we've been in our retired professional football players, prevalence of that hypomania and mania, and we found it was correlated with their history of concussions, and it was also related to inhibitory control. So that's that flavor of I'll never do it, and suddenly,
yes, loss of inhibition.
Yeah.
The dorsolateral prefrontal cortex, it seems to be the most commonly involved part of the brain in CTE, and I think that's involved in some of those inhibitory pathways. Yes, I don't know. Is it the multiple concussions that are causing it, or is it the exposure? Is it the CTE? It could just be the fact that they've had lots of head knocks, and what you're seeing is in the multiple concussion patients is a phenomenon related to that traumatic brain injury, but not caused by CTE. Yes. Oh yes, it could well be. Yes. Thank you.